Assalamualaikum everyone, this is Dr. Abdul Rafi here. Today we will talk about pericoronitis. Basically, pericoronitis has been defined as an inflammation of the gingiva in relation to the crown of incompletely erupted tooth. As you can see in this clinical picture, this is the clinical representation of pericoronitis. There are three types. Number one, acute, subacute, and lastly, the chronic. Now, what is operculum? Basically, the space between the crown of tooth and overlying gingival flap is called operculum, and this is the ideal area for food and debris accumulation. Now, the arrowhead in this clinical picture is showing the operculum. Moving on to clinical features, there can be redness, swelling, it will be a separating lesion, tenderness will be there, radiating pain to ears, foul taste, inability to close jaws, and lastly the trismus. This clinical picture represents all of these clinical features. The redness is there, swelling is there, and because of the operculum over the offending tooth, patient cannot close the jaws. And moving on to the complications, there can be pericoronal abscess. An abscess can spread to oropharyngeal area, leads to difficulty in swelling, involvement of submaxillary, posterior cervical, deep cervical, retropharyngeal lymph nodes. Cellulitis can occur, fever, leukocytosis, and lastly, the malaise. Fever can aid into leukocytosis. And moving on to the treatment. Number one, we can drain the abscess if there is. Number two, irrigation with N-steroid saline, as you can see in this following clinical picture. The third option is that we can surgically excise the overlying soft tissue, the operculum, and the procedure is known as operculectomy, shown in this diagrammatic representation. After operculectomy, the crown will be fully visible in the oral cavity. And the last option in treatment is that we can remove or advise the extraction of the offending tooth. So this was all about the pericoronitis, and I hope you guys liked the video. Thank you.